Mr. President, I rise today in support of the Family Smoking Prevention and Tobacco Control Act. Now, we all know someone who's currently a smoker, someone who has been a smoker, and I know we all worry about their health, and that's with good reason. Tobacco use is the leading preventable cause of death in the United States. It kills more people each year than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides combined. Let me just repeat that, because it's hard to believe, but the fact is, tobacco use kills more people each year than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides combined. And tobacco-related health problems affect millions more, resulting in skyrocketing health care costs every year. The cycle of addiction is so hard to break, and the tobacco companies work hard to attract smokers with flashy marketing campaigns and by including chemicals that are proven to be addictive. Undoubtedly, this hurts our nation's overall health. There's no question that one of the most important steps the Senate can take to improve health and to reduce costs is to reduce the use of tobacco. That's why this legislation is so important, why I'm proud to be one of the 53 co-sponsors of this legislation. And again, over half the Senate is co-sponsoring this legislation. I want to thank Senator Kennedy for his leadership and work on this important issue over so many years, and thank Senator Dodd for managing this bill on the floor. Throughout my career, I have advocated for smoking prevention. We all realize the cost in lives and in health care expenses that smoking creates, not only to the consumer, but also to those who are exposed to the dangerous secondhand smoke. In New Hampshire, almost 20% of adults smoke cigarettes, and tobacco-related health care expenses in New Hampshire amount to $969 million a year. During my tenure as governor, I was proud to sign legislation that banned the sale of tobacco products to minors, that prohibited the possession of tobacco products by children, and that required the New Hampshire Department of Health and Human Services to disclose harmful ingredients in tobacco products. The important legislation that we're considering today expands on what New Hampshire has done. It will give the FDA the authority to regulate the manufacturing, marketing, and sale of tobacco products to youth. In New Hampshire this year alone, 6,300 children will try cigarettes for the first time. Just over a third of these children will become addicted and become lifelong smokers. And the tobacco companies know these statistics and target much of their marketing to this vulnerable population. In fact, published research studies have found that children are 3 times more sensitive to tobacco advertising than adults and are more likely to be influenced to smoke by marketing than by peer pressure. This year in New Hampshire alone, the tobacco companies will spend $128 million on marketing, much of it geared to kids. Tobacco companies also attract children to their products by using flavors such as Twist-A-Lime or Kuai Colada, which says that it contains Hawaiian hints of pineapple and coconut, or Winter Mocha Mint. Doesn't sound like we're talking about tar-filled cigarettes, does it? It sounds like we're talking about ice cream or candy. But unfortunately, these fruit and mint flavors not only entice kids to try them, but also makes the smoke less harsh, more flavorful, so that it's actually easier for kids to smoke. Unfortunately, they don't make cigarettes less dangerous or less addictive. And the tobacco companies don't stop at just the flavors to attract kids. They package the flavored products in colorful and fun patterns, clearly aimed at attracting children to their products. Norma Getz of Derry, New Hampshire, reports that her youngest child is 19 and is addicted to smoking. He buys the mint and fruit-flavored products, and by now is smoking up to 2 packs a day. Already, at age 19, he's developed a smoker's cough. Keith Blessington of Concord is now an adult, but he's also a victim of childhood addiction. He smoked his first cigarette after a basketball game when he was only 17. Recently, he was diagnosed with advanced stomach cancer and told he has about a year to live. And despite this awful situation, despite the fact that he has cancer, he'll tell you plainly, "I'm addicted." He just can't quit. We need to enact this legislation to help people in New Hampshire and across the country, people like Keith, people like Norma's son. Tobacco products and marketing geared to kids need to end. We can't afford to let another generation of young people put themselves at risk by becoming addicted to tobacco products and suffering the lifelong consequences of their addiction, or even worse, dying. For decades, tobacco companies have targeted women and girls, but in the last 2 years, the industry has significantly stepped up their marketing efforts aimed at our daughters and granddaughters. And we have a picture here of one of the ads that R.J. Reynolds uses. It's their new version of Camel cigarettes targeted to girls and women, and it's Camel number 9, sort of a takeoff on some other product descriptions we've heard. This cigarette has sleek, shiny black packaging, flowery ads, and as you can see, the enticing slogan, "Light and Luscious." This advertisement has appeared in Cosmopolitan, Glamour, InStyle, Lucky, and Marie Claire magazines, and it has been effective. Today, about 17% of adult women and about 19% of high school girls are smokers. That's more than 20 million women and more than 1.5 million girls who are at increased risk for lung cancer, for heart attacks, strokes, emphysema, and other deadly diseases. These statistics are staggering, and it's important to remember that they represent mothers, grandmothers, aunts, sisters, colleagues, and friends. 17-year-old Kate Stewart of Dover, New Hampshire, has seen these Camel number 9 advertisements. She saw them in Glamour magazine, but fortunately, she sees through the marketing campaign. She says, and I quote, "Tobacco companies advertise to try and get me and my friends to smoke. They try to make young girls think that smoking is sexy, glamorous, and cool. They know that if they get us to start smoking now, we will be addicted for years to come." Now, it's not just cigarettes that we're attempting to regulate in this legislation. The tobacco companies have also developed new products that are both smokeless and spitless. They're just as addictive as those products you smoke, however, and they're just as deadly. Like cigarettes, they don't have any FDA regulation, and the consequences are dire. I want to show a photo here of a young man named Gruen von Behrens. He's an oral cancer survivor. He's had more than 40 surgeries to save his life, including one radical surgery, and you can see how it left him in this picture. It removed half his neck muscles and lymph nodes and half of his tongue. Like too many teenagers, von Behrens first tried spit tobacco at age 13 to fit in. By age 17, he was diagnosed with cancer. How can we let this happen? The tobacco is targeting our children, and it's our job to protect them. This legislation is vital to our children and to our nation's health. It will prevent the tobacco companies from marketing to children. It will require disclosure of the contents of tobacco products, authorize the FDA to require the reduction or removal of harmful ingredients, and force tobacco companies to scientifically prove any claims about reduced risk of products. The FDA is the proper place to have this authority. It's responsible for protecting consumers from products that cause them harm. The FDA even regulates pet food, yet it doesn't have the authority to provide oversight for tobacco, one of the most dangerous consumer products sold in the United States. Under this legislation, the FDA will oversee tobacco products with the same objective and the same oversight with which it directs all of its activities: to promote and protect public health. It has the necessary scientific expertise, regulatory experience, and public health mission to do the job. We can't wait any longer to make the necessary changes that will impact the lives of so many people we know and love. Again, I want to thank Senator Kennedy for his outstanding leadership on this issue, and join many of my colleagues in supporting this important legislation that will save lives in New Hampshire and across the country.